Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, Registered Dietitians and Nutritionist, Lauren Papanos and Romana Brennan.
Hello, everyone, and welcome to the Nourish MD Podcast. I'm one of your hosts, Lauren Papanos, joined by our other co-host, Romana Brennan. And today we are joined with Stephanie Erickson, and we're going to be talking about geriatric mental well-being, how you can really rethink aging to support your mental well-being, whether you are, dealing with some adverse health complications, or maybe you are in more of a caregiving role. So thank you so much, Stephanie, for being here, and welcome to the show.
Thank you. It's my pleasure.
Why don't you just kick us off with a brief introduction about yourself and your professional background?
Well, it's lengthy because I'm now older. So I'm a clinical social worker. What that means is I have my master's in social work and then did 2 years of clinical background study and then became licensed. And then that makes you licensed social worker in California. I've done all kinds of stuff throughout my career. I started in child welfare, actually, in a protective services position, worked with foster youth before. I've worked in a lot of community settings at a charter high school with adolescents. So I'd say the first, 7, 8 years of my career was mostly with kids. And then I moved into hospice. And that's when I discovered my love for an older adult population. Although some of my patients, unfortunately, were also young, and some were not necessarily even over 65, but the majority were older. I did hospice work for a while, and then I moved to Montreal, actually, and spent 20 years there and just came back to California about 2 years ago. And in Montreal, most of my work was around forensics, meaning that I was involved in decision-making capacities for adults. So anyone over 18, the majority of my clients were seniors and they have dementia. So and basically it's a legal proceeding to see if someone's, I'll use the California terms, if their durable power of attorney is active, meaning I'm no longer able to make decisions for myself. Therefore, I'd like my daughter to make decisions. In the province of Quebec, there's a process to go through, and I was involved in that. Throughout all of these years, I've always maintained a private practice on the side doing therapy. Always a little bit of that on the side. And now I'm concentrated much more on that. I probably spend about 10 hours a week delivering therapy for general counseling, trauma, grief, anxiety, depression, aging issues, family issues, adolescent issues, whatever it might be. I'm doing that. I'm also doing some clinical supervision of students who work at a trauma center out of Cal State Long Beach. And then I'm continuing to do forensics as a standard of care expert. So lots of different kinds of experiences.
That's amazing. Thank you so much for sharing that with us. In today's conversation, focusing really a lot about aging and the aging process. And of course, in a lot of your work, you speak to individuals of all ages, kind of how we can start to even rethink, kind of reframe how our perspective on aging, again, at any age, and kind of making a proactive plan to ensure that we age well. So do you have any resources that you can share with us, or even just describing this process of how can we start to rethink aging, whether we are young, old, somewhere in between?
Yeah, for me, it really started, this thinking about it started when I was working for hospice. Obviously, you begin to look at the end of life. And then I really started to think, wow, people are not ready. They're not ready spiritually. They're not ready emotionally. They're not ready psychologically. Their legal affairs aren't in order. Conversations haven't been had with families. There's a lot of gaps, and our healthcare system doesn't really provide for any of those discussions until you're at the end of your life. In Montreal, because I was working primarily with the population of individuals with dementia, these thoughts came up more and more, and I was going in and out of nursing homes and assisted living homes, and we call them boarding cares here. They're called something else there, but anyways, like homes within the community where people live. And again, just wow, our care, our treatment in North America of the aging population is not great. And people are not ready and they haven't had those discussions. So I actually forgot to mention I wrote a book called Plan for Aging Well, which is a resource. But there are certainly lots of books about aging out there. Of course, you can search online and find out all sorts of things. But I think the primary thing that could happen for individuals of all ages is starting to really think about what values are, what matters most to you, and how you can have those values integrated into your care as you age, as you get older, and not just physically, but in all ways.
What would you say are some of the most common mental health concerns? Maybe if you had to pick top 3 or top 5, the most common mental health concerns that we see in an older or aging population.
Probably 1 and 2 tied would be depression and anxiety, and I think it's because of loneliness. It's very scary getting older, and you start losing your support system. I don't know about you ladies, but I need my girlfriends. Like, they are everything to me. And as we get older, we begin to start losing people that we love and who are our support systems, and our spouses potentially too at some point might go before us. And a lot of older adults are very lonely. They're very, very lonely, and that leads to depression, and it leads to anxiety, and it can lead to cognitive problems as well because the stimulation is missing. So I would say anxiety and depression are top 1 and 2. Grief would be right up there because of all those losses, and it's not just losses of people; it's loss of mobility, it's loss of your career, it's loss of housing if you're having to move because you need assistance. It's loss of your health. It could be loss of hearing, loss of eyesight. There's so many losses, and so grief is a very involved emotion, and so it covers a lot of areas of us. And so grief is probably 3 if I'm going to give you my top 3 off the top of my head.
Yeah, that all makes so much sense. And kind of tying into that, and within your work as a social worker as well as a psychotherapist, what are some of your maybe favorite, most effective therapeutic approaches that you really find the most helpful for this population?
I think with older adults, the first thing I always start with is, I mean, aside from your general intake, where you're covering their functioning as a whole person, in all of their areas, how they're doing. I think starting with a life review and really looking at in their lifespan what have been the most traumatic, gratifying, and hurtful experiences that a person has, and then starting from there and trying to look is what can we resolve now that will help us function in the most present moment. I can give you an example. There's a woman who was referred to me through a doctor, concierge doctor, very much like the office you guys work out of. And this woman was originally referred to me because she had to make some decisions about a procedure. And the family wanted me to help her talk her through. By the time I got out to the house, the procedure was already squashed. They weren't even considering it anymore. But the family, like many adult children, are like, my mom is not safe. I want her to live somewhere else. This is a constant call that I get. How do I get my mom to move? Can you convince her to move? People think I have magic powers. Somehow I'm going to get someone to move. But when I went out to meet with her, one of her major concerns about being in a retirement community was that people were going to ask her about her life and ask her about her relationship with her parents, her mother in particular. And it was such a traumatic childhood that she did not want to reveal it. And so to me, when she told me that, that was at the root of all kinds of things. Her resistance to moving. Her children don't even know any of this information as well. So it was like bleeding into all different areas of her life. So that is, like, for example, where I would start with her. In terms of like treatment modalities, I love cognitive behavioral therapy. I think CBT is like the gold standard because it can apply to so many different presentations. Depression and anxiety in particular, you can use it with trauma's focused CBT. I love it. But I also like family systems. I like to see the person and their environment and how that all works. And those are probably the 2 that I concentrate on the most.
Wonderful. And for you mentioned that depression and anxiety being the top, tied for number one
Mhm.
in terms of the most common mental health concerns in an older population. But from my experience, find that a lot of this population also maybe struggles with the ability to ask for help or the idea of utilizing therapy as a tool to help them on their journey and help with the healing process. So if someone is in that position where they're not really sure about going to therapy for some of these concerns, but they know that they feel lonely or struggling, where can they start and how do you recommend they start to become more comfortable with that process?
That's a great question, Lauren. The older population, therapy is not just part of who they are. Like the younger population, I mean, therapy is just like integrated into our society. Of course, there's still stigma, there's still shame around it, but much less for people that are like 40 and under, right? Than older. I think part of it is just demystifying it. And so I would hope that healthcare professionals would have a way to, first of all, identify that someone needs to have that support, because I think in our medical system, where providers are you know struggling to see people for the length of time that they feel like they really want to spend time with people, aside from like concierges, which are great because they actually have time to really understand their patients. But outside of that, it's like you're lucky if you get 5 minutes from your physician. So number one is like having the health provider even identify that this could be something, and then help to demystifying it and just giving some basic psychoeducation about what it is. And I would suggest to people, either adult children or older adults, to just, when you get a referral for someone who is a trusted referral source, hopefully, just have a brief conversation with them. Talk to them for 15 minutes on the phone. Everyone that I know would do a free phone consult and just get to know them. And you'll see that it's not as scary as you seem. It's really just about having a conversation, and the client is always in control of the pace and the content. So it's not as heavy as one might think it is.
Yeah, I think that's really important to just open the door, right? No little stakes, dip your toe in, have the conversation. You can always say no if you feel like it's not a good fit. And I think some people almost feel the need to have permission to be able to say, okay, no, I think I'm not going to go forward with that, from if they are getting a referral from someone that they know and love.
And on that note, I just want to add that you don't always connect with the first person that you talk to. I have a lot of clients and we work very well together, but that doesn't mean that tomorrow someone's not going to try a session with me and go, she's not right for me. Meanwhile, someone I saw today thinks I'm the best therapist in the world, let's say. So there's personality fits and stuff too. So try a few, try them out, just like you would, want to find a physician or another provider who provides a service that you want to be able to feel comfortable with them. So you can just try people out, and you can always change. You don't have to stick. The other point that I want to make with some challenges in our healthcare system is that, there are insurances that cover mental health, but a lot of providers like myself are not accepting insurance because the insurance process is so convoluted and cumbersome, and it's such a pain for a provider that more and more providers are turning away from accepting insurance because it's too much. It's too much of a hassle. And then now we're shrinking the population who can access mental health services because not everyone can afford to pay out of pocket. So that's not a provider problem. That's more of like a systemic problem that would be wonderful if it changed.
Yeah. On that same note, are there certain support systems in place or government assistance type of programs that might be accessible to individuals who feel like they can't afford it, but who can't find an individual who is covered by their insurance?
Yeah, I mean, there are a lot of those online platforms now. So this is a difference, is you can't get someone in person. But there are still people who you can see in person who take insurance. I'm not saying there aren't, because there are. But those platforms, a lot of them take a lot of insurances, but it's all telehealth. And
Mhm.
so that's not necessarily the best fit for the older adult population. They don't, the younger people kind of don't mind, but once you get older, you really want to see someone in person. But that is an option because they will take more insurances. And Medicare is an insurance that a lot of providers, if they're going to take one, it might be Medicare. That I actually looked into it, taking Medicare, but the process is about 2 years to get accepted as a provider in Medicare. And I was like, forget it. Like, it's just going to take me forever. But there are some, like, for example, at the clinical supervision I do at a trauma center, it's free. No one has to pay to go there. So there are still some community resources like that out there, but they're not easy to find. I have to be honest with you. They're not easy to find.
Yeah. Well, thank you for giving individuals a really helpful place to start. I think that's going to be really impactful for everyone listening. So thank you for that.
Health challenges can feel overwhelming, but expert home care can bring peace of mind. With PPMA at Home, you get access to trusted professional caregivers who provide skilled nursing, therapy, wound care, and more, all in the comfort of your own home. Recover faster, feel supported, and stay connected to your physician and care team with 24/7 communication. PPMA at Home, because healing happens best when you're where you belong. Call today to learn more.
Let's shift the conversation a bit to talk more about cognitive health screenings, because it's something that we do at PPMA. For anyone listening who is a patient, probably familiar with that. But in terms of a screening that maybe you're doing at home or for a loved one, kind of on behalf of friends and family, can you talk us through some of the earliest signs of altered cognitive health and, things that we can look for kind of within ourselves, within others, or things to ask our provider about just to stay proactive in terms of both mental and cognitive health?
Yeah. First of all, don't panic if you can't remember where your keys are, because that doesn't necessarily mean you have Alzheimer's. And I think that this is the fear, right? If something is wrong, that means I have dementia. Oh my God, my life is over. People jump very quickly to that's the worst. And I'm not saying it's a pleasant diagnosis, obviously. But don't panic, because there are some normal things that happen to our cognition as we age. And it doesn't mean that you have Alzheimer's or dementia. Also, some altered cognition can be to other medical concerns that a physician and running blood tests and some other things that can be done can figure out. And then you realize, oh, it's not that I have memory loss. It's that I don't know, I'm making this up, by the way, my thyroid's not working. I don't actually know what a doctor would look at, but there's other tests that can be done. So nobody panic. I think things to think about are a change in functioning, a change in how you can run your day-to-day life. So if you forget where your keys are, but you find them and you go into your car, you're like, yeah, whatever, I forgot my keys one day. But if you're realizing that it's happening to the extent multiple days in a row where now you're not able to leave the house because you're having trouble recalling where you place your keys every day, it's impairing your functioning. And now it's something to bring to your doctor's attention. So I would really just think about when it begins to impair your functioning, when it impairs attending appointments, when your family is mentioning it to you, that you're not recalling conversations or events or plans that you may have. If you're having trouble with your banking, that can obviously have some serious and significant impacts. So you want to look at something like that. And I would say to go to your doctor and ask for at least a yearly screening, just to keep, I guess, to be proactive, because there are medications that can be given to help slow down the progression of these things, should in fact it be an actual diagnosis of, let's say, dementia. So hiding it and not addressing it doesn't actually make it get better. In fact, it can accelerate the difficulties that you might be having. And if you want to be as independent as possible for as long as possible, the sooner you know these things, the sooner you and your family can implement strategies within your current environment to help you function and keep you as independent as possible, versus later down the line, people imposing things on you that maybe you wouldn't have wanted.
Okay. Absolutely. And we're going to cover in our next episode on Nourish MD in about 2 weeks, what are the nutritional things that you can do to be able to prevent cognitive decline and support cognitive health as well, because a lot of these common cognitive decline type issues like Alzheimer's and dementia, we know are very tightly regulated to blood sugar dysregulation and glucose metabolism and things. And so we're going to talk about what some of those, nutritional therapies you can do as well. So be sure to listen to that episode if you want to start to make some changes to be able to help improve your cognitive function. I want to talk a little bit as well outside of the cognitive health screenings for those that are more in the caregiver role. And, maybe they are a child of a individual who they know needs some support, or who, like you mentioned earlier, is kind of like that woman that you spoke with, where she wants her mom to move into assisted living. What can those caregivers, or what are some resources, I suppose, that you can point caregivers to that may be struggling with some of the responsibility and, maybe even the grief as well of kind of losing part of their, mom or dad, if they are dealing with cognitive decline?
Yeah, and it's not even just the grief, it's also the added stress, the logistical stress of things that now now you begin to do on behalf of your parent. And it's the worry that's going on all day long is, oh my God, did my mom get lost again today? Where is she? I'm calling her. She's not answering the phone. So there's also that day-to-day stress, right? At the same time. Um, the Alzheimer's Association has a lot of support groups in place that can be helpful if a parent is living in a residence already and not at home. Oftentimes those residences will have group support as well too. And if not, I would go to the general manager of the residence and say that you want to bring in some support groups into the residence. I don't know why more don't have it, where they would have like a monthly support group for adults who are managing the care of their aging parents. There are people like me who assist families and who work with the adult caregiver to help them manage the stress and the emotional toll that caregiving is taking on them as well, and can also give some strategies in terms of how to implement care when someone is resisting.
I think that's a really key point too, because I'm sure that that's more common than it's not, right? Is that resistance process. And I think that there's a statistic out there that like the most stressful responsibility that you could ever have is one as a caregiver, right? And so, as you mentioned, there's a huge stress load that comes with taking care of a sick, or a individual that needs your constant care. So, what are some daily practices or resources that a caregiver can implement to be able to help support their own mental well-being?
Yeah, I mean, I think it's different if you're a caregiver of someone who you live with or someone who you don't live with. So, for example, my mom, my stepfather has Parkinson's, and my mom is a full time caregiver. And what she can do in terms of time for herself is very limited because she is the one in the home taking care of him all the time. It took a long time for her to agree to bring someone into the home. And it doesn't matter that this is my field, right? I still had to go at my mom's pace, which was slow, in my opinion, as an outsider, to bring help in. She's finally there and she has, help 3 days a week. And now that's allowed her to leave and have some time to herself and to go out and have lunch with friends, or, even just run errands without having to worry and about the difficulty of bringing my stepfather, not to mention the own wear and tear on her body of helping him up and down in a wheelchair and all that, which is putting her at risk too. So for her, it was different. And I think it's really about bringing care in, or bringing friends or family in, and allowing that caregiver to leave and have some time. Also bringing crews in to do things that can relieve the physical challenges. So house cleaning, grocery shopping, big things, window washing, laundry, these kinds of things where as a caregiver, you don't want to say to someone else, oh no, you give him a bath. That's okay. Most people don't want to give up that personal relationship and the personal care. They'll be more willing to give up like the laundry and some other things. It takes time. They're not willing to give it up right away. If you're an adult child taking care of someone, that's going to be a little bit different. You want to try and manage that responsibility with other siblings, should you have them, cousins, aunts, uncles, anyone else in your entourage who you guys can come up with a schedule so that you're each individually spending some time going in and checking in on people. So it's not all falling on you. That's really helpful. Of course, we all know, and I know you guys talk about it, eating well and sleeping. Sleep is huge. Sleep is like one of the most important things we can do for ourselves. Exercise, all those kinds of things to take care of yourself. Those are kind of obvious. I think, though, the biggest work for adult caregivers and also those who are living with someone is realizing that there are other people in the world that can also help do this job. And it's like working with a caregiver to release some of that guilt that they have in not being able to do it all and not connecting that with that means that they're a bad wife or a bad daughter, that those two things are not actually connected at all. And that can be done through therapy and work with someone like myself who specializes in aging.
And are there any financial assistance programs for caregivers who might need help in some of those areas?
Yeah, there is. There's something that you can apply to where they even pay a family caregiver will be given a certain amount of money. This is IHHS, I think is what it's called. I have the acronym written down somewhere. It's not popping in my mind. But yeah, there are some government programs where you can apply to and get assistance. Of course, if you have Medicare, some of the equipment and things like that you may need to get can be ordered for you. You usually have to have like a doctor's order form, or you can go through a home health agency and they can help you order the equipment. So there are some ways to get some assistance that way. There's so much work, though, to be done there because the cost to a family for caring for someone is astronomical. And most people in the end have to pay out of pocket for care. And it's just so costly. And that's why families overextend themselves because they can't afford to pay for someone else to come in and help.
Yeah, I mean, even just the cost of assisted living facilities too is astronomical. So there's really no good solution.
No, and that's a systemic, that's what I was saying to you. It's like the same with the insurance, is there's a much bigger problem here in our society about the value that we place on older adults. And you can see it in the way that we care for them and the lack of systemic supports that we have in place to help families and individuals as they age. There is a real devaluing of older adults, and the money is following in terms of like governmental policies and things like that. Like we really need to look at this as a society and the worth of elders. I mean, other countries have some pretty amazing things going on when they're taking care of their seniors, but they've always seen older adults as part of the family system. They don't see them as you're ill, so now you go somewhere else. They see them as you're ill, now you come to us. And their governments support that kind of a process. And we've never had that in the US. It's always been like, let's send them away.
Yeah, it's definitely a very different care process for sure.
Mm-hmm.
Well, thank you, Stephanie, so much for sharing all of your wisdom and insights. We really appreciate it.
Thank you for joining us for today's episode of Nourish MD, Dr. Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.